is Ondamagang Asmach. I'm a biology major with the pre-med track at University of District of Columbia. One of the major critical health issues that is affecting Black community is cardiovascular disease. Cardiovascular disease has remained the primary cause of deaths in the world as well as in the United States. Every year, more than 600,000 people die due to this epidemic. That is 1 in every 4 deaths. Despite the severity of the disease across the broad spectrum of the nation, there is still tremendous disproportionality among African Americans in the Black community. Although African Americans account for only 13% of U.S. population, nearly 47% of African Americans have some form of heart disease. More than 73% of Black cardiac patients are exposed and compromised to ACE gene. Furthermore, inactivity, poor diet consumption, obesity, unhealthy lifestyle has been identified as a core inducer of heart disease. In the past 6 years, I have been struggling with the drastic weight gain and obesity due to unbalanced poor dieting despite my consistency in the gym. It has significant impact both physically and psychologically. I overcame obstacles by reforming my consumption habit, by balancing diet alternative, and by implementing effective physical activity. Through this process, not only I benefit, but also I was able to impact my family, my friends, as well as my community. My mother had been battling with hypertension and diabetes. I was able to coach my mother. She too had lost over 50 pounds and managed to surpass her prior condition. I currently volunteer in the cardiac unit and by serving in the caring to the patient. As aspiring cardiac surgeon, I believe I have responsibility to facilitate equal opportunity, advocate, and also expand awareness about the chronic disease, despite the prevalence of income barriers and the racial disparity. Through my journey to medical field, I will take a unique approach to serve disadvantaged Black community by teaching the younger generation to eliminate cardiovascular disease. Furthermore, I intend to research and develop advanced ACE inhibitor to deplete ferocity of heart disease among African American community. To further extent, I have a deep desire to establish nonprofit hospitals to create suitable conditions for cardiac patients with disadvantaged backgrounds. I believe being human is ample to help one another. However, when we have the knowledge and the skill, it is our duty to save humanity. I suppose every healthcare practitioner have both moral and a legal obligation to eradicate the epidemics. Most importantly, elimination of racial disparity by providing equal opportunity is vital to tackle chronic cardiovascular disease.